We've had a lot of very positive things happen and had a lot of developments happen over the last 2 weeks since the last time we talked. The first thing I would tell you is just an incredible outpouring of support throughout the community around celebrating our caregivers and making sure that they know that the community appreciates everything that they're doing and the sacrifices that they're having. We have had just organization after organization, person after person come up and donate meals, and we've tried to distribute those around the organization. Recently, the first responders all got together and had a big thank you out in the front yard, almost called a parade, but it wasn't a parade, where they all came out and thanked our staff for doing what they do each and every day. And things like that just mean so much to people when that goes on, more than you can imagine. We are now getting into rapid testing. If you go back in time, a couple weeks ago, we would have 60 to 70 patients here, which were persons under investigation, or patients under investigation, or PUIs, at any given time. Those patients needed to be hospitalized, but we didn't know if they had COVID-19 or if they just had some other illness. And the whole time while they were under investigation, we were using a tremendous amount of PPE and precautions, just assuming that they did have COVID. Vast majority of those patients would always turn out not to, but we didn't know that and had to treat them as if they did. Now with rapid testing, we can do a test on our inpatients that really takes less than 2 hours, sometimes less than an hour even. We wish we had more ability to do more of those, so we are limited by the amount of tests that we are able to procure, but we are able to treat our inpatient or test our inpatient patients each and every day, doing that and keeping our burn rates on our PPE down and getting those results quick. So another really interesting development that we've had going on is our ability to participate in clinical trials. We are now in 2 different clinical trials, really headed up by Dr. Volker and Dr. Fiorica and our IRB. It's been pretty amazing that little Sarasota has been one of the leaders in the nation doing this, and we're hopeful that a lot of our test results and what we have coming out of this really help the nation address this disease in a very meaningful way. We certainly have ongoing challenges that we're addressing each and every day and trying to really understand what the landscape looks like, not just today, not just next week, but how does this affect us over the next 3 months, 6 months, maybe even a year. So we have had to make some very tough decisions. So we have had to furlough a number of employees from the organization. We've tried to do that in a very respectful and thoughtful way. So we're continuing to pay everyone's benefits. While they're furloughed, we've given people extra PTO time to be able to fall back on. We're hoping that this is a very short-term piece and that we're able to pull all these employees back in a very short manner. But we need to wait and see what happens. We are also asking employees to flex off. We've just had a tremendous amount of volume reduction throughout the system. Our inpatient volume is down 40 to 50%. Our outpatient volume is down probably 70, 75%. Our urgent cares are down 70% in volume, and even our ER is down 50% in volume. So that's a tremendous amount of change that's happened in a very short amount of time. I think we're doing everything that we can to address that in a very responsible way to make sure that our system remains the safety net organization for this entire region. So I think it's important to put some reality into what's going on in the hospital itself. We all see the news of what's happening in New York and Italy and other parts of the world and other parts of this country. But let me tell you what's going on in Sarasota. We have around 500 patients in the hospital any given day right now. Around 5% of those are actual COVID positive patients. So the vast majority of our patients are here are for things that have nothing to do with COVID. And so what I want the public to hear and for each of you to hear is that we are open for business. While we do have some moratoriums against elective surgeries or non-emergent surgeries, if you're having heart issues, come to the hospital. If you're having a stroke, come to the hospital. If you have issues, contact your physician, come to the ER, and get those things taken care of. We're very concerned that people are putting off procedures that are going to cause them problems down the road. So I'm asked a lot about when do we return to normal operations? And I got to tell you, I'm not sure I don't have a crystal ball around that. But we are planning on what does normal mean. And it probably means stages. We have proposed regulations and proposed thoughtful ways to do this that would protect the hospital, protect the patients, and protect the community against a resurgence of this disease. As we go through the steps of reopening, we want to do it in a very safe way, a way that the community can have a lot of confidence that this healthcare system is doing the best for the community and for its patients that are here. We are working very closely with these different government organizations in helping them understand the science behind what we see and the experiences that we've learned. And once again, we all still have a lot to learn about this disease, but trying to do it in a very scientific and thoughtful way. So what do we think is going to happen over the next 2 weeks or next month? We think that we will start seeing more of our non-emergent cases come back. We think we'll start seeing more of our outpatient business come back. We want to keep staff very focused and keep our heads down, keep doing the great work that we're doing, keep being a leader, not just in Sarasota, not just in our region and state, but nationally. Once again, we can't say thank you enough. We know that our staff, our medical staff, our clinical staff, the folks that are cleaning the hallways have made tremendous sacrifices each and every day with their families and with their work, being able to come to work. This community owes you a debt of gratitude. This hospital certainly owes you a debt of gratitude, and we just want to tell you we appreciate you and thank you for being here each and every day.